Welcome, everybody, to June. This is Bonnie Maldonado, and I'm the interim chair for the Department of Medicine, and we have lots of updates for this busy month. First of all, we know there are graduations going on all around the Bay Area and the country. We will be celebrating the School of Medicine graduation this coming Saturday, June 15th, and then the university commencement on June 16th. So congratulations to all the graduates. Sunday is also Father's Day, so congratulations and to all the dads out there and for all that you do. Here in the department, we're celebrating Pride Month, and June 18th, we will have a special inclusion rounds on LGBTQ plus family building. We're also celebrating Caribbean American Heritage Month, and on June 19th, we're celebrating Juneteenth, with a special West African dance performance on June 26th. We also have other departmental activities and events to report on. So as you all know, SHC has licensed 24 beds at Sequoia Hospital that are SHC beds, and those went live last month. It was a very successful launch, and we are excited to have those, given that we will have an upcoming closure of 300 PE ground units. So we were facing a bed deficit, and now with these 24 beds at Sequoia, we will still have somewhat of a deficit, but the 24 beds will actually help us out. The unit has already seen 100 Stanford Medicine patients, and under the leadership of Thomas Liu and Nira Ahuja, Sequoia is expanding its patient population to other services across the department and the institution. In addition, patients and families have been highly complimentary of the service that they've received at the new unit and of the quiet healing environment. So thankful to all of you who have been involved with the care of these patients at our new unit, and we're grateful to have those available to us for the foreseeable future. I also want to point out that we have a number of new departmental leaders. As we all know, on May 17th, Anne Mullally came in as the new chief of the Division of Hematology, and we welcome her. We had a reception for her, and we were very happy to see that she's settled in. And we also want to thank Dr. Bev Mitchell for her services as interim chief. In addition, we want to welcome Kevin Schulman and Jason Hom as the new interim division co-chiefs for hospital medicine, and they also started last week. And that was prompted by the movement of Dr. Nira Ahuja to Associate Chief Medical Officer for Inpatient Services at SHC. And so we're grateful to her as well for her continued leadership in that role and for her prior leadership of the inaugural leadership as inaugural division chief of hospital medicine. And we want to thank Kevin and Jason for their new leadership roles and look forward to productive work from them as well. Now, it's with bittersweet news that we also know that Dr. Ray Kim will be leaving after more than 10 years of service as division chief of GI hepatology. He will be going on to an exciting leadership role within the Mayo Clinic enterprise in Arizona as their endowed research leader there. Dr. Linda Nguyen, however, will be taking over as interim chief of that division beginning August 1st. And we want to thank Jib Ray for his service and thank Linda Nguyen for her upcoming new leadership role. And then finally, we also want to mention that Dr. Upi Singh will be leaving Stanford after many years at the helm of the Division of Infectious Diseases. But despite the sad news of her leaving, we're very excited to hear that she will be the incoming chair of the Department of Medicine at the University of Iowa. We want to wish her all the best. Fortunately, we still have Upi with us for some time. She will be leaving at the end of September. So we'll have a chance to get to see her and celebrate everything that she's done to build a remarkable division. And I will be giving you an update soon about the new leadership for the division after she steps down in October. So thanks to all of our great leaders in the divisions and department, and for those who will be stepping in as interim chiefs as well. Now, we know that it's bittersweet to say goodbye to colleagues, but as you know, many of these are people who already are stepping up to other leadership roles here. It's also great to see our Stanford medicine leaders recognized as leaders at other institutions as they move on to higher roles outside of our Stanford community. And they will always be our Stanford community, regardless of whether they're here or elsewhere. And we look forward to keeping them within our community and hearing more updates from them as they move on. Now, it's also award season, and I'm pleased to see that many departmental members were recognized. Teaching awards will be celebrated later this month at a special medicine grand round, so keep your eye on that. One big award I do want to mention is that we have the Stanford Healthcare Primary Physician of the Year Award, and one of our own department members, Dr. Baldeep Singh, who's professor of primary care and population health, received this prestigious award this year. He has a genuine passion for people, which always comes through in how he provides care. His recent work as medical director of Samaritan House underscores his career-long commitment to caring for patients in all socioeconomic ranges. He has also dedicated significant time to medical student and resident education. He certainly embodies the spirit and mission of the department, and it's no surprise that he won this award. And congratulations to Baldeep for this. Now, the last event I wanted to mention is I had the opportunity this last weekend to participate in the Residency End of the Year Banquet, and I was incredibly moved and excited to see the exciting achievements of our residents in the program. We did have 35 graduates, and we celebrated and thanked our outgoing 3 chief residents and our incoming 4 new chief residents for the upcoming 2024 year. So thanks to all of you for the work you've done. I appreciate all that the residents have done to be one of our front lines for our patient care, and as well for their teaching and advocacy and research roles. So overall, I think this is, again, a period of change. We will continue to provide updates on the chair search and the DFA search. Those are moving forward, but I will have more updates hopefully in July for all of you. I want to thank you all for the work you do. It continues to be a busy time clinically, teaching, research, and advocacy-wise. And I know all of you are participating in some way in one or more of those domains. So thank you for everything you do. Try to enjoy the summer months coming up. June has turned out to be a beautiful month, and please take time for yourselves to enjoy the weather, your family members, all of the different celebrations that are occurring this month. And I look forward to talking to you again in July. Thank you so much.
The preceding program is copyrighted by the Board of Trustees of the Leland Stanford Junior University. Please visit us at med.stanford.edu.